Hello everyone, I'm Dr. Geeta Jain. I'm IVF Specialist and Director at Godson IVF Centre, which is a unit of Aastha Hospital. We are based in West Delhi, Vikaspuri. I welcome you all to this interactive session, which is on one of the most popular topics of IVF, which is common myths of IVF, on which we all know, but still few misconceptions are still lying in patients' minds. So today, let's be open about it and clear these myths. So let's begin. डीलिंग विद इनफर्टिलिटी इज टफ. इनफर्टिलिटी इज अ बिग प्रॉब्लम. साइंस लेकिन बहुत एडवांस हो गई है. हमारे पास बहुत सारे ट्रीटमेंट ऑप्शंस हैं nowadays to get pregnancy. IVF is one of the most popular one. एंड बहुत इम्प्रॉपर अंडरस्टैंडिंग की वजह से लोगों के दिमाग में बहुत मिसकंसेप्शंस हैं. आई वुड लाइक टू क्लियर दोस. Let's have a look at the most common myths around IVF that we come across. First is IVF is the only plausible solution which solves all the fertility issues. लोगों को क्या लगता है कि IVF ही एक सोल्यूशन है जिससे सारे फर्टिलिटी इश्यूज सॉल्व हो सकते हैं. ऐसा नहीं है. हर केस डिफरेंट है. कुछ केसेस में आपको IVF तक जाना ही नहीं पड़ता है. देयर सम केसेस जहां पे आपको एग फॉर्मेशन के लिए मेडिसिन दी जाती है, फिर अल्ट्रासाउंड मॉनिटरिंग की जाती है, एंड देन द पेशेंट कैन कंसीव वेरी इजीली. कुछ केसेस में IUI किया जाता है. IUI इज इंट्रा यूट्राइन इंसेमिनेशन, जिसमें हम लेडी के एग्स बनाते हैं विद द हेल्प ऑफ मेडिसिन. देन वी वॉश द हस्बैंड सीमेन. When the egg is ready, we insert the husband semen into the uterus, and that is also very successful. And in some of the cases, that is only done, and which is not a big thing. बहुत बड़ा issue नहीं है, बहुत बड़ा procedure नहीं है. It's very easy to do, and it is like it doesn't need any admission, nothing of that sort. एक लैप्रोस्कोपिक प्रोसीजर से भी हमारे को कई बार पेशेंट्स कंसीव कर जाते हैं. किसी को फाइब्रॉइड्स हैं, हमने रिमूव किए. किसी के कोई ओवेरियन सिस्ट है, किसी का कोई ट्यूब्स में स्लाइट ब्लॉकेज है जो ओपन हो जाता है लैप्रोस्कोपी से. सो दीज पीपल कंसीव विद सिंपलर ट्रीटमेंट्स. नाउ बहुत ही रेयरली होता है कि सिवियर मेल फैक्टर है या ट्यूबल प्रॉब्लम है, ट्यूबल ब्लॉकेज है. देन IVF इज द फर्स्ट एंड द ओनली सोल्यूशन. देयर यू गो फॉर ओनली IVF. So it is not the only solution which solves all the fertility issues. We have other modalities of the treatment which can help the patient. Second myth which people have is IVF is the last treatment to opt if nothing works. लोगों को क्या लगता है कि हमें पहले बाकी ट्रीटमेंट्स करने हैं, अगर नहीं वर्क करेंगे then we'll go for IVF. People waste time, they are wasting years. By the time उनका एज बढ़ जाती है, ओवेरियन रिजर्व खराब हो जाता है. सो कुछ कंडीशंस ऐसी हैं जैसे ट्यूब्स ब्लॉक्ड हैं या सिवियर मेल फैक्टर है या एडवांस मैटरनल एज है. डोंट वेट एंड ट्राई अदर मेथड्स, आई वुड से, बिकॉज आप खुद सोचिए, हाउ विल IUI वर्क इन अ केस वेयर ट्यूब्स आर ब्लॉक्ड? बिकॉज जो एग और स्पर्म है उन्होंने यूनाइट ही ट्यूब के अंदर होना है. वहां यूनाइट होंगे, फर्टिलाइज होकर एम्ब्रियो बनेगा, तभी तो प्रेगनेंसी होगा. If in case the tubes are blocked, how will you conceive with IUI or the simpler treatments? You have to directly go for IVF in such cases. So ये जो सबको लगता है कि एक स्टेप वाइज है कि पहले मेडिसिन स्टार्ट किया, फिर हमने ये IUI किया, फिर हमने IVF किया, ऐसा करने की जरूरत नहीं है. कुछ कंडीशंस में आपको सीधा IVF जाना होता है ना. फिर there is again a misconception that baby conceived through IVF will not be yours. It is not that. Why? Because जब हम IVF करते हैं, वाइफ के एग्स लेते हैं, हस्बैंड के स्पर्म्स लेते हैं, उन्हीं को यूनाइट करके बेबी बनता है. So the baby is 100% genetically related to both the parents when we do IVF. It's just we are assisting it. ART means assisted reproductive techniques. There is nothing artificial about it. So हमने दोनों के ही गैमीट्स लिए, उनको मिक्स किया, उनको यूनाइट होने दिया, फर्टिलाइज होने दिया, एंड देन द एम्ब्रियोज आर फॉर्म्ड एंड देन वी पुट देम इनटू द यूट्रस एंड द रिजल्ट इज द प्रेगनेंसी. सो इवन इफ हम एग और डोनर स्पर्म या डोनर एग भी ले लेते हैं, देन ऑल्सो द चाइल्ड विल बी योर्स. व्हाई? बिकॉज half the genetic component is coming from one of the parents. So I would say that the IVF babies are natural babies. Just keep this out of your mind that वो हमारा बच्चा नहीं होता है जो IVF से होता है. It is all yours because we are using your eggs, your sperms, and we are making the baby. Just we are uniting them outside in the lab. That's the only thing. One more thing which people generally when they come they ask, IVF leads to multiple pregnancies. Yes, it used to be there when we were in olden days, when to increase the chances of conception, used to put around 3 to 4 embryos into the lady. So what used to happen was that used to result in multiple pregnancies. But now this can be prevented. How? Because embryos are well scrutinized. We have the techniques, we have the gadgets to see that. सो वो बहुत वेल स्क्रूटिनाइज्ड होके हम एक दो जो बहुत गुड क्वालिटी एम्ब्रियोज हैं वही लेडी के अंदर डालते हैं. एंड उससे क्या होता है कि इट इज ओनली बेसिकली या तो ट्विंस होगा या सिंगलटन होगा. रादर आप इसके बारे में अपने जो इनफर्टिलिटी स्पेशलिस्ट हैं उनसे भी आप बात कर सकते हो. यू कैन डिस्कस दिस विद हर. You are not interested in multiple pregnancies, and nowadays anyways we are not putting more than 1 to 2 embryos into the uterus usually. So this is prevented nowadays. Nowadays we are not doing this. We are putting 1 to 2 embryos, the good quality ones, and that results in pregnancy. Pehle it was different that time because we had to put lots of embryos to get the results. Moreover, people ask us that IVF leads to birth defects in the babies. It is the most groundless myth कि IVF से malformations या birth defects हो जाते हैं babies में. ऐसा नहीं है. Let me tell you, it is same as the naturally conceived babies. आपका natural conception और ये almost similar है because again वही mother के और father के gametes से ही baby बन रहा है. बल्कि अभी क्या हो रहा है कि इनफैक्ट IVF एंड recent advances आ गए हैं IVF में, जिसको हम PGS और PGD कहते हैं, प्री जेनेटिक डायग्नोसिस एंड प्री जेनेटिक स्क्रीनिंग. उसमें हम उन जेनेटिक एबनॉर्मेलिटीज को जो उनकी फैमिली में है पेशेंट के, वो भी हम अवॉइड कर सकते हैं. विद दीज टेक्निक्स वी कैन screen the genetic abnormal embryos and we can discard them and we can always transfer the good genetically normal embryos into the uterus. So rather than IVF leading to birth defects, we can avoid birth defects with IVF. IVF में आपका ये PGD PGS जो है उससे आप अवॉइड कर सकते हो birth defects. आप उसको स्क्रीन करके you can put the good embryos which are genetically normal into the uterus and resulting in normal babies with the parents who have family history of disorder in the family. And most common myth around IVF is very painful. See, IVF has become very patient friendly now. IVF pain is just more mental than physical. First is we say that injections are painful. No, it is not that. With the advent of technology, we have very fine needles nowadays. जो डायबिटिक लोग इंजेक्शन लगाते हैं विद द इंसुलिन सिरिंज, वी हैव दोस काइंड्स ऑफ सिरिंजेस एंड उनसे लगाया जाता है इंजेक्शन. नॉट पेनफुल एट ऑल. रादर पेशेंट कैन टेक द इंजेक्शंस एट होम ऑन हर ओन. इट इज सो इजी टू टेक. So there is no pain in the injections. Moreover, पुराने जो protocols थे उनमें we used to give 10 to around 15 to 20 days of injections. Nowadays there are short protocols, antagonist protocols we call them. उसमें 10 से 12 दिन injections लगने हैं. The duration of injections are less, the needles are finer, the injections are more concentrated. You need to give a little bit of injection for a high dose also. So injections are again not a problem. The second step which comes in IVF is ovum pickup. Even ovum pickup is not a problem. Why? Because we do it under general anesthesia. And it is hardly a 5 to 10 minutes procedure. And we even don't come to know कब हो गया वो procedure. आप आते हैं सुबह खाली पेट आते हैं. We take you in OT. आपको 5 minutes के लिए ही anesthesia देते हैं. We take out your eggs with a very fine very fine needle. Take out the eggs, and then after 2-3 hours we send you back home. On the same day you have little abdominal cramps, nothing else, and it's a daycare procedure. You don't need to stay in the hospital and you can go home safely. Not a problem at all. Final step which is in this IVF is the embryo transfer. When we put embryos into your uterus, for that we don't even need anesthesia. It's a seconds procedure. उसके लिए हम क्या करते हैं, बहुत ही थिन फ्लेक्सिबल पतला सा कैथेटर होता है जिससे एम्ब्रियोज आपके अंदर डाल देते हैं. इट डजंट इवन पेन एज मच एज आपका TVS या PV एग्जामिनेशन जो आपको पेन कॉज करता है, उससे भी कम पेन इसमें होता है. सो आई वुड से दैट पेन इज नॉट देयर एट ऑल. ऑलमोस्ट नेग्लिजिबल पेन है इन IVF. Major pain is the somewhat mental pain because you don't know whether it's going to be successful or not. And where does the success come from? You don't know because your egg quality, your embryo quality, your sperm quality, your body reaction, your hormonal status, that all decides the success. So that is waiting for the result is the pain. Otherwise, there is no physical pain involved in this. And we do understand your pain and anxiety, and we try and give you the best results possible. Moreover, patients have this notion that IVF cannot be done in postmenopausal group. See, naturally, postmenopausal elderly ladies cannot conceive because their egg reserves are already exhausted. उनके पास eggs नहीं हैं, eggs reserves खत्म हो जाते हैं, बहुत कम रह जाता है ओवरी में eggs. तो उसमें तो आप naturally तो conceive कर नहीं सकते when you cross 40 years of age, but definitely with the help of donor eggs, and if your uterus is healthy, you can conceive with the help of IVF. आप जैसे सोचते हैं कि पोस्ट मीनोपॉजल ग्रुप में आईवीएफ इज नॉट पॉसिबल, रादर इट इज पॉसिबल, ओनली आईवीएफ इज पॉसिबल इन दैट. Natural conception isn't possible in postmenopausal group. Moreover, every couple who comes to talk about the treatment asks the same question: do we need complete bed rest during IVF? See, we have working women who come for the ovum pickup and the same day they go back to the work. From abroad also we get patients, they fly back next day of ET. You don't need to confine yourself to bed after embryo transfer also. You can always go around with continue with your regular day work duties, and there is no problem at all from the very next day of embryo transfer also. So there is nothing like complete bed rest. और जो इसमें जो प्रेगनेंसीज होती हैं, यू डोंट हैव टू कंसिडर देम, यू डोंट हैव टू ट्रीट देम डिफरेंट फ्रॉम द नेचुरल प्रेगनेंसी. ऐसा नहीं है कि आईवीएफ प्रेगनेंसी है तो मुझे बिस्तर पे ही रहना है. इट इज नॉट दैट वे. और नेचुरल प्रेगनेंसी में यू कैन स्टिल कीप वर्किंग. इट्स द सेम. वही क्वेश्चंस इसमें भी आपको एडवाइस हम करते हैं कि आपको लिफ्टिंग हेवी वेट्स अवॉइड करना है, आपको सडन मूवमेंट्स, टू व्हीलर राइड्स अवॉइड करना है. You have to avoid running, moving, jumping and over exertion. वो सब आपको natural pregnancy में भी we tell you to avoid. So you have to avoid. And this also, I mean, it's the same, not a problem. I mean, IVF is very simple. It's just we are assisting you, nothing new. The things which are naturally happening, we are just assisting you in that. Moreover, कई लोग कहते हैं कि क्या IVF में 100% success rate है? No medical treatment has a 100% success rate. World over data says that 40 to 50% of the success इसमें होता है, and false assurances देते हैं, लोग गारंटी करते हैं, which is not fine. क्योंकि आपकी बॉडी कैसे रिएक्ट करेगी, आपकी एज, आपके कंडीशन ऑफ द यूट्रस, द कंडीशन ऑफ द एम्ब्रियोज, योर हार्मोनल स्टेटस, all this matters. The success rate depends on all this. It is not at all possible if someone tells you मैं गारंटी देता हूँ, तो that is false. I mean, don't fall for all this. It's not there. I mean, it's not possible to have 100% success rate. And moreover, finally, I mean, लोग सोचते हैं कि only rich people should opt for IVF. We agree that IVF is expensive. The reason being the equipment needed to make embryos and maintain their growth are costly. जो हमारे IVF लैब में जो इक्विपमेंट्स होते हैं, जो उसमें एम्ब्रियोज बनाने के लिए, ग्रोथ करने के लिए, उनको मेंटेन करने के लिए जो इक्विपमेंट्स है वो कॉस्टली हैं. मोरओवर जो इंजेक्शंस हम लगाते हैं फॉर द एग फॉर्मेशन, इवन दे आर कॉस्टली. But it is to be noted that cost of IVF has not gone up through these years. It has rather come down. And काफ़ी इंश्योरेंस कंपनीज आपको कवर देती हैं फॉर द IVF ट्रीटमेंट. काफ़ी सारे लोन प्रोवाइडर्स आपको इंटरेस्ट फ्री लोन्स देते हैं. So nowadays it is easy for every class of patient to go through IVF because the charges are not high. The insurance companies and the loan providers, they are there to help you. We are also there to help you. I mean, it's possible. I hope I could clear most of the doubts regarding IVF, and I would say that IVF gives you the gift of experiencing the magical joy of motherhood. The woman experiences pregnancy and birth of a baby. Thank you.
Let's take up.
Yeah. Let's take up the questions now. One second. Yeah, 1 minute. What is embryo? Kritika Kumari has asked, what is embryo freezing, ma'am? See, when we make embryos, usually what happens is, one second. Yeah, when we make embryos, usually what happens, we end up making around 10 to 12 embryos. And what happens is, basically, one or two embryos we are going to put into into the lady. Rest of the embryos we are going to freeze for the future use. Freezing is actually, we take the embryos, we take them into the freezing media and put them into liquid nitrogen cans, which have the temperature of minus 196 degrees Celsius, and these embryos are frozen or stored for about more, they're stored for nearly 10 years. So if in case the person is not successful in the first shot, they can go for frozen embryo transfer in the second cycle, or if in case she conceives also and she wants a second baby after 3 years or so, that is also possible there. So what happens is, it renders them inactive there, and they are in suspended animation. The embryo stays in liquid nitrogen and they can be used for future use. This is embryo freezing, which can be used for the later times. श्रवण कुमार इज आस्किंग कितने दिन इंजेक्शन लगता है आईवीएफ में. सी इंजेक्शंस यूजुअली व्हाट वी डू इज, पहले बहुत लंबे लगते थे. पहले जब साइकिल्स होती थी, वी यूज्ड टू हैव लॉन्ग प्रोटोकॉल्स एंड 20-25 दिन इंजेक्शंस लगते थे. Nowadays we are giving injections for around 10 to 12 days. 10-12 दिन इंजेक्शन देने के बाद उसको हम रेडी हो जाता है, यूजुअली एग्स फॉलिकल्स रेडी हो जाते हैं. देन वी गिव द इंजेक्शन फॉर द रप्चर and then we take out the embryos after 36 hours of the final injection. Moreover, एक इंजेक्शन बीच में और हम ऐड करते हैं. दिस इज द रेगुलर इंजेक्शन फॉर द एग फॉर्मेशन. देन अराउंड जब हमारा फॉलिकल अप्रोक्सीमेटली 14 हो जाता है, तो हम एक इंजेक्शन और ऐड करते हैं ऑन द रेगुलर बेसिस, सो दैट दे डू नॉट रप्चर ऑन देयर ओन. इफ दे रप्चर ऑन देयर ओन, जिस दिन हम फॉलिक ओवम पिकअप करेंगे, उस दिन हमारे पास कोई भी ओवम नहीं निकलेगा, कोई भी एग नहीं निकलेगा. सो इंजेक्शंस जो है अप्रोक्सीमेटली 10 से 12 दिन लगते हैं हमारे. Sona is asking which is the important factor which determines IVF success. The most important factor I told you is the age. Age is the most important factor, क्योंकि age के साथ, as I told you, egg reserves कम हो जाते हैं and it's not possible to conceive if you don't have an egg. और फिर हम क्या करते हैं, if the age is advanced, patient comes to us, we'll do TVS एग्जामिनेशन टू सी कितना एंट्रल फॉलिकल काउंट है, मतलब कितने फॉलिकल्स एक्सपेक्ट कर सकते हैं हम. सेकेंडली वी गो फॉर AMH लेवल्स एंड दैट आल्सो गिव्स अस एन आइडिया कि कितना ओवरी में एग जनरेटिंग कैपेसिटी है. मोर ओवर, जब हम ये क्लियर हो जाता है कि एज ज्यादा है, देन वी जनरली, हमें लगा कि सारे रिपोर्ट्स भी खराब आ रहे हैं, देन वी कैन गो फॉर डोनर एग्स. वी जनरली गो फॉर डोनर एग्स. Because if in case we get 2-3 eggs also, the chances of miscarriage or failed pregnancy are very high if we have those eggs which have aged. So the most important factor is, I would say, maternal age is the most important factor. Sunena is asking, guidance is very okay. Shalu is asking, what happens to the unused embryos? To the unused embryos, if we have around 10 embryos, as I told you, and we have already transferred 2, and we have around 8 unused embryos, we freeze them the way I told you in liquid nitrogen. We put them and they can be used later on in the next cycle if the first cycle fails, or you can go for further cycles after about 3 years, 4 years, whenever. These embryos can be used later on, because we put those embryos into liquid nitrogen and they remain there in suspended animation, can be used after 10 years also. This can also be done. Yeah. How do I know if I need donor eggs? Ruxana is asking. See, first thing is, donor eggs are usually required in the patients who cannot make their own eggs. So what we do is, first, as I told you, we'll see the age, then we'll go for we'll go for the antral follicle count on the second day of periods. We'll see whether she can make follicles, how many small follicles are there. That is the calculation we can make, how many follicles can be made out of it. AMH लेवल से भी हमें अंदाजा हो जाता है जो हम कराएंगे। एंड जब हमें पता चल जाता है कि AMH इज लो, योर एंट्रल फॉलिकल काउंट इज लो, एज इज एडवांस्ड, LHFSH is high, we know that your ovaries are not working anymore or they are not working so well. So what we do is, in this case, we go for donor eggs. And donor eggs, we have plenty of agencies nowadays working. They have nice donors, I mean young donors who have good quality, who give good quality eggs, and they are always tested for HIV, HBsAg and everything. And their tests are done, then only we take them. And then we take the donor eggs and we make embryos. We put those embryos into the mother. She gets pregnant. Now, Kajal Yadav is asking, is IVF painful? IVF, I told you, is not that painful because, again, the injections are nowadays given with a very fine needle. Very few days of injections are there. Around 10 to 12 days, you have to give injections. That too with a very fine needle. Ovum pickup is done under general anesthesia and it's a daycare procedure, no pain involved at all. Embryo transfer is a very short procedure, not painful at all. So I just don't worry, it's not painful. Don't take it as painful. It's like almost negligible pain. Uh, yeah, Madonna is asking how many injections do we need to take in IVF? Again, the same thing. We take around 10 to 12 days of injections. And after 10 to 12 days, we give an injection for the rupture of follicles. And after 36 hours of that injection, we take out the eggs. Not a big thing at all. Around 10 to 12 days it takes for the injections to go on. And those can be taken at home also. The lady can take, they're given with a very fine needle. They can be taken at home also. Self administration is possible with this. Evie is asking, how many eggs will you to retrieve? As many as possible, but eggs, we would like that we should have plenty of eggs. But we do take care that we give controlled ovarian hyperstimulation. Why ovarian stimulation? Why? Because if there is hyperstimulation, there would be a problem. If हमने बहुत ज़्यादा इंजेक्शंस दिए इस उम्मीद में कि हमें बहुत सारे एग्स मिलेंगे, बट होता क्या है कि अगर आपने बहुत ज़्यादा इंजेक्शंस दिए, कई बार ओवरीज हाइपर स्टिमुलेट हो जाती हैं, उससे बहुत प्रॉब्लम्स होती हैं। ओवर स्टिमुलेशन से पेट में पानी भर जाता है, बहुत ज़्यादा वॉमिटिंग होता है, इट्स लाइक liver, kidney also sometimes gets affected. So we try to have plenty of eggs, but still controlled. So around 12 to 15 is more than enough, I would say. Lakshmi Kumari is asking, how does age affect fertility? एज के साथ पूरा आपके ओवेरियन रिजर्व्स खराब हो जाते हैं. When a baby is born, the egg reserves are very high. We have 20 to 40 lakhs of ova. And then at the time of puberty, we have around 4 lakhs. And if a person is 35 years plus, we are left with only 25,000 eggs, ova. So chances of having eggs after 35 years of age is very less, and after 40 it's almost negligible. So I would say age के साथ ovary function बिल्कुल खत्म हो जाता है and you have to go for donor egg. And age के साथ but uterus में कोई changes नहीं आते हैं usually, unless until you develop fibroid or anything, but otherwise there's no problem with the uterus. Men की fertility remains till 50 years of age, not a problem at all. So we need donor eggs after a certain age. तो एज के साथ fertility definitely gets affected. I would say if you're planning some career issues or some preoccupancies are there and you want to delay your pregnancy, go for egg freezing. This is the new thing which has come up. आप अपना वो बनाओ, इंजेक्शन से एग्स बनाओ, आप एग्स निकलवाओ और आप उनको फ्रीज करा लो, और आप फिर चाहे 10 साल बाद आप प्रेगनेंसी प्लान कर लो, नॉट अ प्रॉब्लम एट ऑल. So nowadays there are late marriages, then career issues, then many other issues. So better go for egg freezing if in case you're planning for a long period of a time. Trishna is asking, what is the best age for IVF? Best age, I would say, is we say as soon as possible. After your marriage, wait for 1 year and then you have to plan it as soon as possible. Go to the infertility specialist, get your test done. Maybe you don't need an IVF. I mean, there are other modalities also. So just start working on it after 1 year of the marriage. Best age I would say is like around before 20, 35 years of age is the best time. If everything is okay, then why does it get failed, ma'am? Yeah, sometimes we feel that the eggs are of good quality. We can see in the microscope that the embryos are also fine, the sperms are also fine, the uterus is also fine, but uterus doesn't accept the embryo. This is like sometimes we cannot make out the defects which are there in the embryo, and so they do not get implanted. So this is very common that we plan something, we think that thing everything is okay, and we expect pregnancy in a person, but somehow there are some defects which we cannot make out, and that is the reason the success rate is around 40 to 50% in IVF. Yeah, Brijesh is asking how much time come with you for IVF procedure. Yeah, you have to come for around, maybe you come for the first time, we'll investigate you. After investigations, we might give you some oral contraceptive pills for some period of a time. In some cases we give, in some cases we don't give. We have to weigh things accordingly. And then after that, we give you injections for about 12 days. In between, we call you for the ultrasound monitoring. And then 36, we give you a rupture injection. 36 hours later, we take out your eggs. If in case we find that your uterus is very receptive, your endometrial lining is good, we might give you injection, we might do embryo transfer in the same cycle. Otherwise we may defer it for the next month. कई बार हम अगले महीने के लिए उन एम्ब्रियोज को फ्रीज करके रख लेते हैं, अगर हमें लगता है कि जो आपके एग्स, आपके एम्ब्रियोज हैं वो ठीक है, बट आपका यूट्रस अभी रेडी नहीं है टू टेक द एम्ब्रियोज. Ranjana, yeah, can I get pregnant at 40 with IVF? Definitely yes. You can get pregnant at 40 with IVF, mostly with donor eggs, because at 40 usually the ovarian reserves are not good, but still we investigate before planning everything, and we can this is definitely possible at 40 with the donor eggs. If your uterus is fine, if other things are okay, definitely it is possible. Yeah. What should I avoid during injections take? See, what you should avoid is, you should avoid smoking, you should avoid drinking, you should avoid the herbal supplements you are not sure what they contain, you should avoid overexertion, jumping around, the two-wheeler rides as I told you, and you should start taking folic acid supplements 3 months prior to your IVF planning. Rather, you should stop taking drinks and stop smoking also 3 months prior to when you plan your IVF. Karishma is asking, how long does IVF injections take? Again, the same thing. IVF injections usually are given for 10 to 12 days. Initially, it used to be like 20, 25 days of injections, but now the protocols have changed. People don't have that much of a time to do all this. So around 10 to 12 days of injections is like more than enough. And then we give injection for the rupture, take out your eggs, and then we do the embryo transfer. Mansi is asking, how many stages are there in IVF? Mansi, I told you there are 3 stages in IVF. First is, I would say 4 stages. First is we investigate you. We do all the blood tests and everything. We decide on how to go about it, whether donor eggs, whether your own eggs, whether donor semen, your own semen, whether the endometrial lining will form easily or not. And then after investigations, injections is the one stage. We give you injections for 10 to 12 days. Then ovum pickup is there. Ovum pickup, we take out your eggs with a fine needle after 36 hours of trigger injection. And then final stage is the embryo transfer, which gives us the final result. And after that, we wait for about 15 days to find the result. Yes. I think I have answered all the questions. And if you have any more questions, you can always connect to me at Godsend IVF Center and at the phone number which is given in the description box. And Godsend is always there to help you and to help you with all your queries also. With this, I would like to conclude with the session. Thank you so much and best of luck to all.
Aastha Hospital, a place where care is culture.